I was talking to a chiropractor this morning about the adhesion release opportunity that's starting in December. Fixing patients, delivering more impact to chronic pain sufferers, making more income, have a better quality of life. And he was saying about our Instagram post yesterday, we were talking about the low back pain, the left testicle ache, and the first and second toe numbness. And he's like, how you put those pieces together, that was fucking awesome. And I want to be able to do that for my patients. I want to be able to deliver better impact. I just want to be a master at this. And I was like, that's awesome, because there's no better technique or system to be able to do this besides what we're going to be doing in the next few months. And then he said one of his issues with active release technique was that you have to go back and get recertified once a year in order to maintain that certification. And I said, okay, I just want to be really transparent with you, because if you truly want what you just said, which is to master fixing chronic pain issues and to know all the diagnostic pieces and for patients to be able to trust you, we're expecting that this is going to be at least 4 on-sites per year for us to be able to deliver the value to you that you want, so that you can get where you said you just want to go. So you didn't like the once a year recertification. I expect that you're going to do at least 4 per year. And just know that when I was doing a massive amount of training and studying, so from between 2015 to 2020, I was going up to Boston almost every other week to see my mentor, Dr. Brady, who created the system integrated diagnosis. I spent over $100,000 that year. And there were 2 or 3 years where I spent over $100,000 in order to get from a place of not really helping people that much to having the practice that we do at Barefoot Rehab, where we see 200 patients per week, charging $3,000 to $4,000 up front, seeing having 2 other associate doctors, and where people can really trust us. And he said, oh, that's interesting. So in order to get to point B, which is what I said I want, I need to do at least 4 on-sites. And I said, yes. And so he's like, okay, you gave me some food for thought. And so I don't want to sugarcoat anything. The system is straightforward, and we will make it as easy as physically possible. But this is not easy. If you're not somebody who hasn't loved studying and love diving into a subject that you really want to master and get good at, and love spending time every single day, if you were an athlete and you weren't trying to be the best athlete and win championships, you're probably not going to do well with this. So I really want to be transparent up front with anybody who potentially wants to take advantage of this adhesion release opportunity, so that you're not getting into something that is not going to serve you. Because if you're joining our beta launch, you need to fucking do well. You need to get massive value from this. You need to start increasing your rates. You need to start fixing people who you haven't fixed before, because we need that in order to grow this. We need you to be massively successful in order to get more doctors and therapists who say, oh my God, every person who signs up with this ends up crushing and transforming their practice and having the life of their dreams, and their patients, people suffering in chronic pain, are getting so much better. That's what we need from you. So we need to let you know what the expectations are. So now, like, oh, I'm going to do 1 training, 1 on-site, and I'm going to be good to go. No, it's going to be a lot over a long period of time. Minimum 4 on-sites per year. So really consider, is that something you're willing to invest in? Because if you're not, it's perfectly okay, and I fully respect it. But if you say that you want to do this, minimum of 4 on-sites. So let us know. DM me beta, and we could see if you're qualified to be a candidate for the adhesion release opportunity. I love you.